I think we're running a little bit behind, so we can take 2 minutes of Q&A. So are there any questions from the audience? I guess I can ask some questions. Going to the imaging thing, Dr. Holmes, when do you think we will get to the point that I just mentioned, that we might be able to actually make the diagnosis of a basal cell carcinoma without pathology, without any other tools, by just the imaging, by the AI and the OCT or any other imaging device?
So I think you may or may not be aware that they are using imaging in Germany for rule-in diagnosis. So then the question will be, can you then apply the AI to that process? And I think that could be very soon indeed. Of course, there's a regulatory process to go through, and we have to look at the benefit versus risk profile of doing this sort of thing. But for rule-in diagnosis of low-risk BCC, I do think that's a very real near-term possibility in the right regulatory framework.
Yeah, probably for a lot of the tumors, with combination of a lot of the things that was presented between the ultrasound and OCT and confocal, and maybe combining a lot of those devices. So Google already has an app that supposedly can make a diagnosis on some things. But I mean, it's not FDA cleared in the US, but it's approved in Europe for making some of those diagnostic things. So it's actually quite interesting.
Hi, Ann Chappis from New York. Those were all great. I love the LiDAR presentation. I can't wait to play with that. Those programs are so expensive, and there's so many applications in dermatology and laser surgery. But Patricia, I have a huge question. How does deoxycholic acid work on the neurofibromas?
It's interesting. We don't know, to be honest. Which is, I mean, as much as, listen, I'm a scientist and I'm very, very into mechanisms of things, because you also wonder what else can we treat with deoxycholic acid injections. But at the same time, we also want to get this to, the kids sooner than later. So on some level, I kind of don't care. It's sort of like oral propranolol for infantile hemangiomas. Like, we know it works, but, if it's safe and we haven't scarred anyone and it's, avoiding surgery, then I'm okay with it, so.
Yes, go ahead. You can introduce yourself.
Thank you for Dr. Rich. I just have one question. I know that CNF has somewhat growth stages, and just wonder if we've treated it in earlier stage, it works better later or not?
Yeah, it's interesting. Despite the fact that it's, for a rare disease, pretty common, and there's actually a giant study that's been going on for years at Hopkins looking at how the tumors change over time. And I agree with you. I don't think we'll know until we start treating really early tumors. But even on, one patient, they have 4 to 5 different tumor morphologies. And I do suspect that even, treating an extremity versus a trunk, or an early tumor versus a late, might change how you treat them. I think things probably are more vascular earlier. So alexandrite may work better than deoxycholic acid in that setting. But we don't know, so we're figuring it out.
Dr. Zachary?
Chris Zachary, UCI. Okay, I'm looking for a LiDAR scanner software here on my iPhone, and there are at least 4 of them. So which do I buy?
So actually, the one that we use for the purpose of this study is actually free. It's called Scaniverse. This is non-CME, right?
I've got it, yes, Scaniverse. I get it, I press the button, and amazing, it's in 3D.
Yes. The fun bit is that I think all the information, it can be uploaded to the cloud, but it's mostly just stored on your phone. And actually, even though it's available should be available on all iPhones following the iPhone 12 Pro, I was actually able to use it on my old 2020 SEs. So, have fun with it. You can use it for many things. Just heads up, there are, to my knowledge, no HIPAA-compliant LiDAR scanners yet. So, this is definitely more in the early developmental phase than anything.
Very nice. And just one quick question, since we have all the experts here and multiple talks on axillary hyperhidrosis. So what is your go-to then, after all of these talks, device for treatment of axillary hyperhidrosis?
What's the goal?
What is your go-to device? What would you use? Would you use the laser? Would you use the microsound ultrasound? Would you?
I think it depends from patient to patients. If somebody is really looking for long-term results, I do have a MiraDry device, which is a lot more expensive, more painful, then I would use that. Someone who doesn't want this tumescent anesthesia injected for 1 whole hour with 5 pins in their axilla, then obviously the Aerolase Neo device is much more convenient and pain-free.
Great. Do you have any comment?
Yeah, I totally agree with that. I mean, the benefit of having so many options at our disposal, or at least more options, is that we really can then target it to our patients. So if they're, as you said, if they're averse to needles, we now have a patch option. If they're kind of going for a more one and done, microwave-based, energy-based devices is an option. So, I don't think we have one singular option that is the best one. I think there are pros and cons to each of the aforementioned options.
Perfect. And I think just a quick comment about ultrasound that you mentioned for the imaging. I think that's becoming really, really a good tool too. So there's a lot of imaging tools that are available now. We have the optical coherence tomography, we have the ultrasound that are available, we have the reflexes confocal microscopy. There's a lot of imaging devices that are coming to the market. So I think perhaps using a lot of these AIs to try to integrate a lot of these applications together to really make the diagnosis would be really, really helpful. Anyway, thank you so much. Excellent talk, excellent comments and questions.